All right, let's add a critical component to the discussion, and that is the element of mental health care. The Chief and I are now joined by Dr. Carmen McIntyre. She's the Chief Medical Officer with the Detroit Wayne Mental Health Authority. Doctor, thank you very much for coming.
Thanks for having me.
Before we get into your area of expertise, Chief, let me let you weigh in quickly. How often, though, are we seeing mental health care really being at the core of the problem? And I don't expect you to have an exact percentage, but this must be something your officers come in contact with every day.
Big issue. Devin, I can tell you, not just here in Detroit, off air we talked about my time in Maine and how our police officers were confronting situations involving the mental ill. It is a public safety crisis. It's an issue for us, and it's when you look across America, we've had in excess of last year 355 shooting incidents, large part involving those suffering from mental illness.
Doctor, we hear from families of those who are mentally ill all the time, and this is a horrible place that we've gotten to. Often they have to hope that their loved one gets arrested because that may be the only place that they end up getting some kind of help. That doesn't speak well for us.
No, it doesn't. And, you know, right now, the way the law works is that you actually have to have dangerous behavior in order to be... First, you have to demonstrate that in the last 72 hours before you can actually be required to get treatment. So the Diversion Council, run by Lieutenant Governor Calley, is working on that with Judge Mack, who had been local, trying to make it easier for folks to get their family members into treatment without first displaying that dangerous behavior.
So just suspecting that there may be a problem brewing in someone really isn't enough to sort of have treatment mandated then, correct? Correct,
not to have it mandated. If the person's willing, and unfortunately, part and parcel with mental illness is frequently poor judgment and poor insight. Yeah. So if the person's willing, our services are certainly here and available, but you have to be willing.
If everybody who wants to avail themselves of mental health care, though, is the system there? Is it ready for them? Because we're told time and again that this stuff has been cut to the bone. It's been taken out of every, not just Michigan, every state's budget is really not equipped to handle this problem that we keep saying is a priority, but we don't act like it is.
Well, here's the weird thing. We have services in Michigan for people who have no insurance, but that budget keeps getting cut. And then we've got the public behavioral health services that are also available for folks with Medicaid or who have lost their other benefits. But then you get a lot of people who fall in between, you know, that they're working as an independent contractor, so they don't have insurance, but their resources are too much to get the public behavioral health system. So, no, we don't have a catch-all system for everyone.
And how much of this is because there's still such a stigma attached to mental health care? If you had a cast on your arm,
right.
I understand
Absolutely.
that. If you have cancer, I understand that. People can't always get their minds around a mental problem.
Right. Could you imagine having a telethon for depression? You know, as opposed to like muscular dystrophy? It'd be great if we got to the point where I could tell someone I have depression, I have anxiety, I have PTSD, and you receive it the same way that you do if I just told you I have hypertension. So one of the things that we are doing is training in mental health first aid. We've trained 10,000 people so far. We've recently expanded what we're doing with the first responders in delivering that so that people recognize it, they get comfortable with it, they know how to refer people for treatment, and it's not something that's weird and scary.
Chief, that's a tough one because psychiatrists and psychologists have enough trouble figuring out how to deal with somebody who's in a state of stress. We look at those two emergency medical technicians coming face to face with it in such a violent way. How ready are your officers for this great unknown that they may run into at any given moment?
It's a challenge. I mean, we talk about those first responders, our EMS. We talk about our police officer that, you know, also was attacked by a woman suffering from mental illness. They had no idea. And then all of a sudden it happened. So it's a problem, it's a crisis, and unfortunately, we're very reactionary. So we wait till the bad thing happens. We wait till a mass shooting incident, and we try to figure out, well, what do we need to do in a reactive way? And then once we start talking about what we can do better, then we go on to something else. This is a sustained public safety issue. We need to stop talking and we need to start doing. It's a big issue, and it's not getting better. And, you know, I talked off air about the necessity to support our children. I'm talking middle school age children who are suffering from PTSD.
Yeah, from what they've seen in their
Yes.
lives. Yeah. Doctor, it's a little depressing. It feels like we haven't come very far from the horror stories of the 60s and 70s when we saw what was going on in mental health care institutions. Now, those scenes have just been transplanted, haven't they, to jails and prisons?
Absolutely. Absolutely. So a number of things that we're doing along the lines of what happened to the EMT. We're expanding what we've already started with Chief Craig here in Detroit to do this kind of mental health first aid training throughout Wayne County. We're also making people want to work in our system. You know, we had the legislature increase the minimum wage, but they didn't give us funding to pay the people that we help take care of. So we've been able to get $20 million to increase the care for direct care wages by $1 an hour. So it keeps good people working in our system instead of going to fast food where they can get a living wage.
That is no doubt about it. That's an enormous problem. But so is this issue of needing to see dangerous behavior first. That seems fraught with peril. Thank you both so much for the conversation. It's a very important component of it. And Happy New Year.
Happy New Year.
Will it be a Happy New Year for the city of Detroit? John Gallagher will be here to talk about the big projects on the horizon. This is Flashpoint on Local 4.